we talk about the comfort level and the motivation of the patient, but we're also talking about, the fact that it's off label. So I imagine we've got to set very strict expectations because it's off label. Can, either one of you that wants to jump in about that, like how do you prep that kind of patient because with any adult Ortho-K patient, I always say, you need to set proper expectations because adult eyes are obviously different from younger eyes. And let's start with you actually, what kind of expectations should be starting with, a patient, because this is not your typical run of the mill kind of case.
Sure. And I think I'm very different in my way of doing this in my practice than Matthew and probably most doctors. Because when you're doing off-label things, document, get forms signed, like very legal ways of doing things, right? And I was like that when I first started practicing. And I've moved away from that, probably 8 years ago. So I'm not advocating for this for other people that are listening. I think doctors should make sure they're taken care of on the legal side of it. But I'm just saying, you asked me a question, and what do I do? Mm-hmm. I don't have a lot of forms. I've just never believed in it. I don't have a form that says, hey, you're an adult and we're going translimbal and this is off label and you got to sign this and understand all this. Because I'm of the belief that, well, if you wanted to sue me, you're going to sue me. If you're a good enough lawyer, you're going to win. And if you like me enough, you're probably not going to sue. So I've always focused my entire business model off of a patient experience. So I don't want them to go through 3 pages of documentation going through. They want to do it. They want to do it. It's all about patient selection and that patient experience. So to me, they have the same form. They have an adult form and a myopia control form. So the adult form, I don't go into the difference of translimbal design and this. It's all off label. So who cares, right? Like I don't have my patient sign a form that I'm going to do Lotamax for allergic conjunctivitis or something because it's off label. I just don't do that. I'm not going to do it with Ortho-K. They're investing a lot in me because they were probably referred to us for some reason. They heard about us online, whatever reason they got to us. I'm going to take care of them because they're the solution. The biggest thing that I do is patient selection. Like that's the number one. If there's a few things in design that are really important, we'll maybe get into that. Patient selection is number one with adult cases. And I turn away adults way more than kids. I can't remember a lot of kids that I turned away for Ortho-K. I mean, and we get the crazy cases, like I don't have a -2 myopia. I have the -6, -2, 6-year-old, unfortunately. But with adults, I do turn them away because they're coming in that, had LASIK, which doesn't make it impossible, but harder. Very severe dry eye, which is a very big no-no for me. And they have expectations that aren't reasonable. Like I'm 55 years old and I want to see perfect everywhere, even though I don't see perfect everywhere with my glasses. Okay, well, no, this is not going to work for you. You have too many flaws that's going to make this successful. So I am not big on the documentation side. I know most doctors are, including some of the mentors I mentioned that are. So I don't think there's a wrong way. But when you ask me what do, I make it personal. I tell them, hey, what are the realistic expectations? So I have them entrust me, and I don't make it anything about kind of the legality side.
Right. Matthew.
Interestingly enough, I fall very much in the same camp as Anith on this.
Oh, I didn't know that.
Yeah.
I thought you were the opposite of me.
No, a big part of it's patient selection for me. And a big part of it is, there's a really good article by Malcolm Gladwell talks about malpractice. And basically what it says is that when you look at malpractice numbers, the people that get sued most are the ones that are arrogant and condescending to their patients and don't involve patients in patient care. So my take has always been that if I'm going to do something that I'm going to do for you, I would not do anything for you I wouldn't do for my own family member. If you were my brother, I would fit my brother in these if I thought my brother could touch his eyes. He can't, which is a discussion unto itself. But my attitude has always been that same concept. And when I start out a patient, especially with translimbal hyperopic Ortho-K, I tell them we're going to go on this journey together. I'm excited. We're going to design this lens. I'm thinking it's going to be fantastic. We're going to give it a shot and see where it takes us. And then when it doesn't work or if things aren't perfect, I will pull, like today I had the one, the pastor we talked about. I had him perfect 20/20 at distance, and kind of okay at near. And he's like, I'd like a little bit more reading at near. And so I worked on his case and I kind of messed it up a little bit. And I took him from being a plus 150 when I wanted to get to plus 2, and I ended up with a bullseye design. So like I created a multifocal where the center was plus a quarter, right? So like I really screwed up the power structure. And I pulled up the topography. I'm like, here's what I did wrong. And he was like, thanks for showing me. And I'm like, yeah, well, we're going to tweak this around, go back to the old one for right now. I'm going to get with a buddy of mine and see if I can't figure out what I did wrong. But he is totally okay with that because I am willing to show him and talk to him and involve him in the care. So I think a big part of it is having that rapport and that willingness to have a patient who wants to go on this adventure with you. I think that's a big part of it. And I think that's kind of what you're saying, right? Like you're a little bit less paperwork and a little bit more, let's do this together. Let's be successful.
Yeah. I mean, I think it's very similar to your multifocal IOL selection, right? Or your I would say even more than a multifocal contact lens selection, but I think that's the most important part. Like, are they willing to know, hey, this is not a one. You're a complicated case. It may take a few designs. And it's not going to be perfect. You have to be okay with it. You have to convince me. You have to tell me that you want to be out of glasses so bad that you're willing to try it. And when they tell me like, oh, hey, especially when it's a parent, that's the worst because they see how good their kids did. Like, oh, wow, my baby girl did so well. I'm a -3. Why can't I do this? Like, what are your goals? Like, oh, I want to see like her. I want to be perfect. So like the adults are always going to take a lot more hand-holding. They're going to be surprised by the comfort. They're going to be surprised when their kids did so well, especially when they did well in the first design and they didn't do well in the first design. You got to make an adjustment. I have a great story about it. I had a young child that was came in for myopia control. We did an Ortho-K. She was probably a higher RX than her mom, but she did fantastic. Mom sees it like, I want to get out of this. And I was like, okay, this is years ago, maybe 7 years ago. And she's like a -2 or -3, simple myo. Like, yeah, no problem. I can definitely do that. We designed a custom Ortho-K design. And the worst thing you can do in an adult, I induce a central island, right? So now they see worse. And the issue is that's easily fixed. We all know as doctors, we can fix a central island. It's an easy fix, but you know that perception. And she had to get out of it. She couldn't just deal with going 2 weeks. You know, and I was trying to explain, like, well, yeah, give me one more chance and I'll fix it. And take this month off and you'll have the rest of your life of the freedom of vision without glasses, but just couldn't get past it. So I would be very careful in your adult selection for sure.
If you're interested in getting the rest of the episode, consider becoming a paid supporter of the Myopia Mindset. In addition to an extended version of this episode and every other episode that we do, you'll also get access to exclusive monthly bonus episodes of the Myopia Mindset. And I know you're interested. You've made it this far. You can do so on our Substack, myopiamindset.substack.com. I'll see you at the next one.